Okay, starting with the vitamins. So, commonly asked questions are regarding the regarding the clinical features which are produced by deficiency of enzymes or in case of hypervitaminosis. So, talking about dermatitis. In dermatitis, we get deficiency of pyridoxine, biotin, B3 and B4, and niacin. Niacin produces photodermatitis. So the deficiency of these three vitamins will get dermatitis. So mnemonic here will be B2, B3, B6, B7, and biotin. Next, dementia. Dementia is seen in deficiency of thiamine, niacin, and vitamin B12 deficiency. So mnemonic here will be NCCT. For vitamin B12, we have used cyanocobalamin. So NCCT, niacin, cyanocobalamin, and thiamine for dementia. Next is angular stomatitis. It is seen in the deficiency of riboflavin, niacin, and pyridoxine. Rubric here is B2, B3, B6. Riboflavin, niacin, and pyridoxine. Next are the tongue changes in vitamin deficiency. So tongue changes in vitamin deficiency. First one, magenta tongue, which is seen in riboflavin deficiency. Beefy, fiery red tongue, which is seen in niacin deficiency. Baldness of the tongue, which is seen in B12 deficiency. Painful tongue, which is seen in folic acid deficiency. Okay. Next are peculiarities of vitamins. Vitamin B and vitamin C are water-soluble vitamins. Vitamin A, D, E, K are fat-soluble vitamins. Vitamin which are synthesized by intestinal bacteria are vitamin B and vitamin K. Vitamin K and B are also heat stable and light sensitive. Ascorbic acid or vitamin C and folic acid are heat labile. Next, in case of deficiency of fat-soluble vitamins that are A, D, E, K, we get malabsorption syndrome, blind loop syndrome, steatorrhea, celiac disease, celiac sprue, and cystic fibrosis. Deficiency of vitamin B complex leads to dermatitis, glossitis, and diarrhea. Coenzyme vitamins which act as coenzyme are biotin and vitamin K, and which act as coenzyme after their modification. Coenzyme after their modification are thiamine as TPP and riboflavin in FAD and FMN, niacin in NAD and NADP, pantothenic acid as pentothene myotis, folic acid as THF. Next, vitamins which don't act as coenzyme are vitamin D and vitamin A, C, E. Vitamins which act as hormones are vitamin A and vitamin D. Next, coming to vitamins table. So it has first given you fat soluble vitamins and then water soluble vitamins. Vitamin A, D, E, K are fat soluble vitamins and vitamin B and C are water soluble vitamins. So what is important? You have to remember the deficiency of each vitamin, the picture you will get, and the daily requirement of the vitamins. Daily requirement are not frequently asked, but they will give you the clinical picture and you have to get the deficiency of which vitamin is there. In case of vitamin A, it's the daily requirement for retinol is 6 milligrams and beta carotene is 48 micrograms. Its active form is retinol. It protects against cancer, heart disease, night blindness, and stroke. It has a role in vision and formation of bone and teeth. Then deficiency of vitamin A causes night blindness, xerophthalmia, keratomalacia, follicular hyperkeratosis. Vitamin D requirement is 300 to 400 milligrams. Its active form is calcitriol. Calcium and phosphate absorption is helped by vitamin D. Bone growth, protects against muscle weakness, osteoarthritis, and cancer. Its deficiency leads to rickets in children and osteomalacia in adults. Vitamin E, which is again fat soluble vitamin, tocopherol is the name. Its daily requirement is 10 milligrams. Has antioxidant properties. It protects the cell membrane, unsaturated phospholipids, and it prevents lipid peroxidations. Its deficiency leads to increased fragility of erythrocytes and it leads to infertility. Vitamin K daily requirement is 80 milligrams, and it's a clotting vitamin, and it is found in the vegetables and also synthesized by intestinal flora. In vegetables we get K1 phylloquinone, and in intestinal flora we get K2 menaquinone, and its synthetic form is K3, which is menadione. And it helps in the synthesis of clotting factors, factor 2, 7, 9, 10, protein C and protein S. Its deficiency leads to hemorrhagic diseases of the newborn. A vitamin which is both fat soluble and water soluble is vitamin P, which is bioflavonoid. It has a powerful antioxidant property and is good for cardiac health and prevents atherosclerosis along with vitamin C. Coming to the water soluble vitamins, that is first is vitamin B1, another name thiamine. Its daily requirement is 1.2 milligrams. Active form is TPP. Then its cofactor are pyruvate, alpha ketoglutarate, dehydrogenase, and transketolase. Its deficiency leads to beriberi, wet beriberi, peripheral neuropathy, Wernicke-Korsakoff syndrome, lactic acidosis, and edema. Vitamin B12, another name is riboflavin. Its daily requirement is 1.3 milligrams, precursor to the coenzyme FMN and FAD. Its deficiency leads to glossitis, chlosis, dermatitis, corneal ulceration. Vitamin B3 deficiency leads to plagra. Another name is for B3 is niacin. Daily requirement is 16 milligrams. Plagra represents itself as diarrhea, dementia, and dermatitis. D3. Next, vitamin B5. Another name is pantothenic acid. Daily requirement is 5 milligrams. Its active form is coenzyme A. It's an anti-stress vitamin and energy production from the foodstuff. Its deficiency leads to dermatitis, alopecia, adrenal insufficiency, enteritis, and is used in the treatment of anxiety and depression. Next is vitamin B6. Another name is pyridoxine. Daily requirement is 1.3 milligrams. It is required for transaminase and decarboxylation reaction and helps in elimination, antibody formation, and red cell formation. Its deficiency leads to seizure, hyperhomocysteinuria, premenstrual syndrome. Next is vitamin B7. Daily requirement is 30 milligrams. Its active form is carboxybiotin. It is required for carboxylation reaction. Glucose, fatty acid, and leucine synthesis are done in the presence of biotin. Its deficiency is rare and it may be associated with the antibiotic use or consumption of raw egg. Symptoms will be dermatitis and alopecia. Vitamin B9, folic acid, another water-soluble vitamin. Its daily requirement is 400 milligrams. Its active form is THFA, that is tetrahydrofolic acid. It prevents neural tube defects in the neonates if given in early pregnancy. It promotes energy production, RBC synthesis, and brain food. Its deficiency leads to megaloblastic and macrocytic anemia. Coming to vitamin B12, cyanocobalamin, its daily requirement is 2.4 milligrams and it helps in formation of blood cells, utilization of iron, amino acid metabolism, regeneration of folate. Its deficiency is very much common in vegetarians and is caused by lack of intrinsic factor seen in pernicious anemia, gastric bypass, Crohn's disease, malabsorption, sprue, and D-latum. Next is vitamin C, ascorbic acid. Daily requirement is 120 milligrams. It acts as an antioxidant, anti-erythrogenic, cofactor for dopa-B hydroxylase. It has a role in collagen synthesis, reduction reaction, and prevents neural atheism. Its deficiency leads to scurvy. Commonly asked question from the vitamin. In pancreatic insufficiency, we get deficiency of vitamin A. Milling of rice causes loss of thiamine, vitamin B2, and protein also. Parboiling preserves above vitamins. Niacin deficiency is always associated with the paradoxin deficiency and is required. Paradoxal phosphate is required for synthesis of niacin from tryptophan. Riboflavin deficiency occurs in infants under phototherapy. Mild hemolytic anemia is associated with vitamin A deficiency. Coenzyme A synthesis requires B6 and coenzyme A in the form of pantothenic acid. Oro-oculogenital syndrome is Behcet syndrome or Plagra variant, may occur in deficiency of riboflavin and B6. Vitamins which are detrimental in excess, hypervitaminosis is seen in vitamin A, D, niacin and paradoxin, which are not seen in excess vitamin C, which are excreted in urine, vitamin C. Sulfur containing vitamins are thiamine and biotin. Vitamin required for metabolism of sulfur containing amino acid B12, folic acid and B6. Hormonal vitamins are vitamin A and vitamin. Coming first to vitamin B1, also known as anurin. It is useful in carbohydrate utilization and is related to carbohydrate content of the diet. Its deficiency causes decreased energy production because it is a coenzyme for transketolase in HMP pathway. Here it is much useful in the TPP pathway as a transketolase. It helps in conversion of glucose to pyruvic acid and lactic acid. So, TPP, thymine pyrophosphate, is a cofactor in three multi-enzymes which catalyzes oxidative decarboxylation reaction. It in oxidative decarboxylation reaction of pyruvate dehydrogenase, in alpha Kg dehydrogenase, pyruvate decarboxylase, branched chain keto acid dehydrogenase. Its deficiency is seen in alcoholics, chronic diarrhea, and food fatists. It is diagnosed by decreased RBC transketolase activity in the blood, which improves after adding TPP. It is associated with lactic acidosis and pyruvate accumulation. Deficiency diseases are wet beriberi, dry beriberi, and Wernicke-Korsakoff syndrome. In Wernicke-Korsakoff syndrome, encephalopathy and edema responds to the thymine, but psychosis is not treated by giving the thymine. Okay, it is also used in the treatment of hangovers. Next, vitamin B2, that is riboflavin. Riboflavin act as FMN and FAD, that is flavin mononucleotide and flavin adenodinucleotide. It acts as a coenzyme for various H transfer reaction in electron transfer chain, and its aqueous solution is unstable and visible in UV light. Its deficiency may occur in infants under phototherapy. Its requirement is related to the protein content of the diet, and its deficiency is related to RBC glutathione reductase activity. So it can be diagnosed by decrease in RBC glutathione reductase activity. Next vitamin is niacin, nicotinic acid, vitamin B3. So daily requirement for niacin is 16 milligrams, and this B group is synthesized in the body. Its deficiency causes plagra D3, D3 that is diarrhea, dementia and dermatitis. Deficiency occurs in children receiving maize diet as a staple food and other like corn, jowar in excess. Deficiency also occurs in chronic diarrhea, anorexia and carcinoid syndrome. It is synthesized in the body from tryptophan, and deficiency is assessed by Connex's reaction. Its requirement increase in heart nerve disease and schizophrenia. Deficiency may lead to raw beef tongue, red and sore tongue. Deficiency causes plagra, which is already told, dermatitis, diarrhea, and dementia. Kaiser necklace, glove, and stocking type of dermatitis occurs in this. Toxicity is also associated with flushing and hepatotoxicity. Next, niacin has a relaxing effect on anxiety and is also called nature's Valium. It reduces the anxiety. So, tryptophan is also called provitamin B3 and is a precursor of serotonin. It is nature's sleeping pill. Tryptophan. High reading point in niacin, it belongs to the vitamin B group, which is synthesized in the body. Its symptoms are associated with Hartnup's disease and schizophrenia, and they mimic pellagra also. Neurotoxicity is seen in excess of vitamin B6. Next, pantothenic acid, which is a constituent of coenzyme A. Its deficiency lead to burning feet syndrome and alopecia. Next is vitamin B6 or pyridoxine. Deficiency of nutritional origin is rare in childhood deficiency, and it may occur as prolonged INH and cycloserine therapy in TB and penicillamine therapy in Wilson's disease. So it is commonly found in patients with cycloserine therapy and INH therapy in TB patients and penicillamine therapy in Wilson's disease patients. Then other drugs which may cause B6 deficiency are L-DOPA, OCPs, carbonyl reagents, and alcoholism. Its requirement is related to protein content of the diet, and pyridoxal P act as coenzyme with transaminase, SGOT and SGPT, decarboxylation, deamination, and cystathione synthase. It is involved in metabolism of sulfur-containing amino acid and protein and fatty acid. Deficiency of B6 homocysteine level increases. That is why it is used in the treatment of homocystinuria and cystathionuria. Xanthourenic index is used to measure B6 deficiency and tryptophan metabolites. Increased urinine is also seen in this condition. Homocystinuria, cystathionuria, xanthourenic aciduria, and urinase deficiency and hyperoxaluria are seen in the inborn error of metabolism, which are related with pyridoxine. Another important thing is it has a role as a coenzyme from pantothenic acid, synthesis of niacin from tryptophan, and synthesis of heme precursor and melanin. It is involved in the generation of GABA, serotonin, melatonin, histamine, catecholamines, and decarboxylation reactions. Confirmation is for confirmation of diagnosis of deficiency is done by tryptophan loading test, erythrocyte aspartate aminotransferase measurement. Deficiency leads to convulsion, microcytic hypochromic anemia refractory to iron therapy. Pyridoxine deficiency is associated with neonatal seizures, Parkinson-like features, pellagra, peripheral neuropathy. Excess dose may lead to sensory neuropathy. Important point here is xanthourenic index, which is used for pyridoxine deficiency and tryptophan metabolism. Parkinson-like features are seen in B2 and B6 deficiency. Neurotoxicity is seen in excess of vitamin B6. Biotin, also called vitamin B7, coenzyme R, or vitamin H. It is a coenzyme for carboxylation reaction. Example in pyruvate carboxylase, acetyl-CoA carboxylase, propionyl-CoA carboxylase. Its deficiency leads to Lennar's disease, dermatitis, pectoral eye alopecia in experimental animals. It evident present in the raw egg is the antagonist of biotin. Enzyme bound biotin is biocytin. Dietary deficiency is unknown. Biotin independent carboxylation reaction is carbamyl phosphate synthase in urea synthesis, and there is addition of carbon dioxide to form C6 in purine group, pyruvate malate by the malic enzyme. Vitamin B12 cyancobalamine. It is the extrinsic factor of Castle. Its deficiency is associated with megaloblastic anemia, centrosical scotoma, homocystinuria, dementia, subacute combined cord degeneration, impotency, restless leg syndrome. Dietary deficiency of B12 is common in strict vegetarians, gastric pernicious anemia, Crohn's disease. Intrinsic factor of Kessel helps in absorption of B12, and Kessel's disease is pernicious anemia, genetically determined condition in which the person is unable to absorb vitamin B12 because of specific gastric atrophy, loss of intrinsic factor. Deficiency of vitamin B12 leads to functional folate deficiency and affects the dividing cells, which this folate is required for DNA synthesis, and it affects the bone marrow, leading to megaloblastic anemia. Treatment of megaloblastic anemia is with vitamin B12 and folic acid. Vitamin B12 dependent enzymes are methylmalonyl-CoA mutase, leucine aminomutase, and methionine synthase. B4 tetrahydrobiopterin is a coenzyme and are phenylalanine hydroxylase, tyrosine hydroxylase, and nitrous oxide synthase. Its deficiency may lead to neural tube defects, hyperhomocystinemia, and increases the incidence of atherosclerosis, thrombosis, and hypertension. One major form, one carbon unit folate is methylene tetrahydrofolate. Next, tetrahydrofolate is the carrier of one carbon moiety in the synthesis of methionine, thymine, and purine. Histidine is basically figlu plus folic acid. Next is folic acid, vitamin B9, also called THF tetrahydrofolate, which is the carrier of one carbon moiety in the synthesis of methionine, thymine, and purine. The blood form of folate is methyl tetrahydrofolate. Its deficiency is associated with megaloblastic anemia, neural tube defects, trophic glossitis, homocystinemia, and restless leg syndrome. It is given as supplementation in early pregnancy and prevents fetal neural tube defects. Deficiency leads to alcoholism, drug therapy with sulfasalazine, paramethamine, tranamiterine. Niacin deficiency causes folate deficiency because folate cannot be converted into its active form, THE, as NAPH, required as a coenzyme. Restless leg syndrome is caused by iron, folic acid deficiency, and uremia. Coming to the differentiating points, vitamin B12 is the extrinsic factor of Kessel or required for RBC maturation factor, also known as RBC maturation factor. THF, tetrahydrofolate folic acid, as a one carbon moiety donor. Both are present in the animal diet. Vitamin B12 acts as a coenzyme for homocysteine, methyltransferase, methylmalonyl-CoA mutase, leucine, aminomutase, methionine synthesis. Deficiency is assessed by methylmalonyl aciduria index and here by figlu excretion in the urine. CNS effect is present in the vitamin B12 deficiency. Test here is Skilling's test, and for folate it is histidine load test. Coming to ascorbic acid, it is a water soluble acid, water soluble vitamin, and it is a most heat labile vitamin. It decreases the low density lipoprotein. It is anti-erythrogenic in nature. It is a strong reducing agent. It has antioxidant property and prevents the risk of upper respiratory tract infection, esophageal and gastric cancers. It is not synthesized in human beings due to deficiency of enzyme gluconolectone oxidase. It is involved in collagen synthesis, bone and teeth formation, formation of hydroxyproline, oxidation of tyrosine and phenylalanine, maintaining integrity of bound substance in hemopoiesis, synthesis of epinephrine, norepinephrine, bile acid, and its concentration is marked in pituitary gland, adrenal cortex, corpus luteum. Its deficiency leads to scurvy, which is gross irritability, excess crying, frog position, and pseudoparalysis. Its supplementation is used in Chidik-Hikashi syndrome and osteogenesis imperfecta. It is not synthesized in human beings and is due to deficiency of enzyme gluconolectone oxidase. It is required for the conversion of folate to tetrahydrofolate and for the synthesis of noradrenaline, used for the formation of hydroxylysine, and also it helps in and also it helps in formation of vitamin K and B by intestinal floras. Coming to vitamin E, tocopherol, it is a heat labile vitamin and it increases the high density lipoprotein. It is anti-neoplastic in nature, most powerful, most important antioxidant and free radical scavenger, helps in integrity of the cell membrane. It is anti-sterility vitamin and it has a sparing effect shown by selenium. Its deficiency causes muscle dystrophies, nocturnal muscle cramps, creatinuria, intermittent claudication, fibrocystic breast disease. Its excess leads to necrotizing enterocolitis in the newborn. It causes mild hemolysis ataxia due to antioxidant property and used for prevention of retinopathy, prematurity, bronchopulmonary dysplasia, hemolytic anemia, myopathies, neuromuscular diseases, thrombosis, fibroadenosis, etc. It slows down the progression of HIV to AIDS. Next is vitamin D. Vitamin D, the richest source is halibut liver oil. It is the most important biological form of vitamin, and its active form is calcitriol. Also, a medicinal form of vitamin D formula is 125 dihydroxycholecalciferol. Cholecalciferol is the animal source, and orgestrol is consumed in the milk in the plant source. It is considered as a pro-hormone. Calcitriol is a hormone. Next, high vitamin D is protective against prostate cancer, colorectal cancer, and prediabetes. Synthetic vitamin D, orgocalciferol, is used for fortification of food in the milk, infant formula, breakfast cereals in the US. Its daily requirement in adult is 100 international units. In children, it is 200 international units. In pregnancy, it is 400 international units. Deficiency leads to rickets in children, osteomalacia in adults. Its deficiency leads to renal osteodystrophy, diabetes mellitus, cancer, and cardiac diseases. Excess is seen in sarcoidosis, hypercalcemia, along with decreased appetite. Vitamin A. Retinal is the main component of visual pigment rhodopsin. It occurs in the rod cells of retina and responsible for the vision in the poor light. Various forms are beta carotene, two molecules of vitamin A joined end to end. Here, carotene, which is the precursor of vitamin A found in the plant food. Preformed vitamin A is found in the animal food. 95% of vitamin A is stored in the form of retinol ester, mainly as palmitate in the liver. Its daily requirement is 600 milligrams in adults, 350 in infants. Both retinoids and carotenoids have anti-cancer activity, and its overdose causes injury to the lysosomes. Coming to vitamin K, it is seen in gamma carboxylation of the glutamic acid. It is required for post-translational gamma carboxylation of glutamic acid necessary for clotting factor 2, 7, 9, 10. Protein C, protein S, bone protein, osteocalcin, nephrocalcin, vascular smooth muscle protein, gala protein. Product of gene growth arrest specific C. It's a necessary cofactor for oxidative phosphorylation and is required for the synthesis of calcium binding proteins, osteocalcin and BMPs. Its prophylactic dose is given in newborns to prevent hemolytic diseases uh, as 1 mg intramuscular in intralateral thigh. Only fat soluble vitamin with specific coenzyme function. Along with vitamin D, it is used in the treatment of osteoporosis. Vitamin K1 or phenylquinone is the natural form synthesized by plants. Intestinal flora synthesize K2 as menaquinone, and vitamin K acts as a coenzyme for carboxylation reaction biotin. In gamma carboxylation, Vitamin K is used in hydroxylation of procollagen. Then next topic is minerals. So macronutrients or minerals. So the daily requirement for macro minerals is more than 100 milligrams per day, and it constitutes 60 to 80% of the body's inorganic material. These are calcium, phosphorus, manganese, sulfur, sodium, potassium, chloride. So, coming to micronutrient minerals or trace elements, these are minerals whose daily requirement is less than 100 milligrams per day. The gross category is essential, possibly essential, and non essential. Essential ones are iron, copper, iodine, manganese, zinc, cobalt, ferrous, selenium, and chromium. Possibly essential nickel, vanadium, cadmium, barium. Non essential are alumina, lead, mercury, boron, silver, and Bi. Then clinical manifestation for deficiency of zinc is periolar pustular rash, acrodermatitis. For copper, it is microcytic anemia. For chromium, it is hyperglycemia. For manganese, it is dermatitis. Selenium acts as a cofactor for glutathione peroxidase, selenocysteine, and deiodinase. It is found to prevent liver cell necrosis. Selenium deficiency causes Kishan disease, endemic cardiomyopathy, and Kashin-Beck's disease, endemic osteoarthritis of China. It is rich in garlic. It has antioxidant and anti-cancerous property. Also, it has effect on vitamin E. It reduces vitamin E requirement. Its deficiency produces atherosclerosis and tumorigenesis. Toxicity causes alopecia, neuropathy, lung nasal carcinoma, and liver necrosis. Next is zinc. So, deficiency of zinc causes acrodermatitis enteropathica, impaired spermatogenesis, hypogonadism, and dwarfism. Excess causes anemia, acute respiratory distress syndrome, pulmonary fibrosis. Maximum concentration is found in prostates. Metraxins are matrix metalloproteinases. MMPs are calcium dependent zinc containing endopeptidases. Copper is present in blood, combines with alpha globulin and forms ceruloplasmin. Its deficiency causes growth retardation, refractory subperiosteal hypochromic anemia, neutropenia, hematoma, osteoporosis, and hypercholesterolemia. Its excess causes Fanconi-like syndrome or hemolytic anemia. Its maximum concentration are found in the prostate. So this table is showing the inherited defect of the copper metabolism. First, if there is defect in the ATP7B gene, there will be accumulation of copper in the liver and brain and will produce Wilson's disease. If there is defect in the ATP7A gene, there will be copper transport defect and it will produce Menkes kinky hair disease. Menkes kinky hair disease or syndrome is a X-linked recessive disorder. It is neurodegenerative disorder due to deficiency of copper. It is characterized by fine silvery wiry hair, duffy skin. There is progressive neurological deterioration. And next mineral is chromium. It is also called glucose tolerance factor and it is a potentiator of insulin. Its deficiency causes hyperglycemia, glycosuria, peripheral neuropathy, and encephalopathy. There will be increased HDL and decreased LDL and decreased cholesterol in because of chromium. It is anti-erythrogenic in nature. Important points from the minerals. Cytochrome oxidase contains ferrous and copper. Lipase lecithinase requires calcium for activation. Selenium deficiency, cobalt excess, and iron excess causes cardiomyopathy. Selenium deficiency causes hypothyroidism. Manganese deficiency is associated with dermatitis. Manganese toxicity is associated with Parkinsonism. Aluminum excess is associated with Alzheimer's disease. Cadmium toxicity leads to ouch disease. Then, thalamium in groundwater causes black foot disease.